discovering opportunities and understanding the challenges that actually regard Pakistan's social and economic development. This year, our fellows are confronting the pertinent topics such as the social determinants of health, telemedicine, and the healthcare access, and also resilience, amongst other areas. Also this year, we have a practicing internal medicine physician and epidemiology researcher, a recent Yale graduate who works in the intersection of political science and the global health, and also a senior undergraduate who is concerned with the effect of academic driven policymaking. One last sort of thought here is that our fellows use the sort of like the experiential learning format, where they connect the theory and knowledge, which will hopefully successfully impact their careers. And also their identity. And of course, as our former fellows grow, we will always have room for all of our APF programs and such for them, so they can shape their own actual future through us. With the support of you and all of the entire APF community, you make all this happen. So please make sure that you stay involved, and also look forward to the more great things happening. So now I'd like to introduce Miss Mahabat and also Miss Hanya Chima. They both have been a major asset for this operation, and they will walk you through the next steps.
Thank you very much, Henry. And hello, everybody. My name is Maha. I'm one of the executive administrators of APF, and congratulations to all of the fellows for completing their fellowships. It's a major milestone, and I'm really excited to see your presentations. You're muted, Hania.
Thank you, Maha. So Maha will be helping us on the back end with all the speakers and switching them on and switching them off. So thank you for starting that, Maha. Really looking forward to hearing what all the fellows have to say. It's been an honor to be the fellowship coordinator this year, and to be part of the process from the start to the finish, and it culminates today. One thing of housekeeping right at the start, want to share that if anyone who's attending has questions, they can write those down in the chat box, and Hassan will be taking those questions towards the end. Now, before we introduce the fellows, we'll quickly introduce Dr. Nasser Qureshi, who is the board chair for APF. Dr. Nasser, would you like to say a few words?
Thank you so much, Hania. Before I say something, Hassan, do you want to clarify whether they should be written in chat or to yourself?
Absolutely. A warm welcome to everybody. Thank you for joining this morning. So anybody who has any questions, will have about 10 to 15 minutes towards the end of the presentation to answer those, whether that's from the fellows or anybody who's joined who's on the panel or the attendees. You can either put them in the journal comment box, or you can direct them to me, and I'll write them down, and we'll talk about it in the end.
Thank you, Hassan. And Hassan is our chair of APF's communication committee, and an amazing asset, and is always present when we need him. So I just wanted to welcome everyone. Of course, the fellowship program is one of our major programs. It's one of our signature programs, and the longest running program. And while we've had fellows go to Pakistan pre-COVID, COVID sort of didn't allow us to do that. and we will be looking to see an opportunity when we think that we can send a fellow safely back to Pakistan. While COVID happened, Dr. Sarah Said Khurram, who is an amazing lady and has set up this wonderful organization, came to our rescue and started taking our fellows, and we had 3 of them there. And everyone who has done a fellowship with Syed Khani has laurels to say about it. And I really want to thank Dr. Said Khurram and her team, especially Mehak Merchant and Alina Likhani, who were the people who basically mentored the fellows at Syed Khani for the entire summer. I'm also grateful to Atlantic Council. This is the 2nd year, I believe, we've had a fellow with them, and Uzair Yunus, who you would be hearing from very soon, for allowing us this opportunity and making this a wonderful experience for our fellows there. And of course, the APF team, coming to this point where we are today, it really is a lot of effort, from sending out notices for nominations, receiving all the applications, going through them, selecting. And we do get a lot of applications, so all of the fellows who are here should feel really proud, because we go through anywhere from 50 to 100 applications. And Hania has done a tremendous job. This was her first year working with the fellowship program, and she put it all together. And of course, Hassan was there. And Henry joined in the mid-process of the fellowship, but he's helped us take it to completion. And of course, the next speaker, Dr. Uzma, who is the chair of the programming committee, lends a tremendous amount of effort and advice to all of the programs, especially the fellowship program. So thank you, everyone, for making this happen. And we are very proud to be with our fellows and with our sponsors today, and look forward to hearing from all of you. Thank you, Hania.
Thank you, Dr. Nasser. Dr. Uzma, would you please like to say a few words? Dr. Uzma is the chair of the programming committee at APF. Please, the mic is yours.
Thank you so much, Hania and Nasser. I welcome everyone to this call. I wanted to echo everything that Nasser just said. It's been nothing but an honor to be part of this this whole process that APF has started almost a decade, if not a little more than that ago. What I want to bring to attention is just a little bit of a metaphysical aspect of all of this. We used to say it was such a small world, but I think the phrase now should be what a connected world. So, you know, I just see among the fellows is one of the persons, and you will hear from her, amazing young woman who I connected to the APF mentorship program. And it's amazing how you connect with each other. And similarly, a big part of, in my opinion, this exercise is definitely, as Henry said, experiential learning forward, seeing what values we can gain and add to the world. But in addition, also creating a community we can, reach out to in the times of need. If not need, then just when you may need just a shoulder or like a sounding board. So I think it's extremely important. And of course, I've been very fortunate to work with, Sarah and her team. I was visiting Pakistan, I think July, and on a very short notice, we did a webinar talking about breast cancer with the female physicians there. So their opportunities are endless. I think there are 2 ways to take this. One is that you make these connections end today with these presentations, and the better, more connected way will be stay involved, stay engaged with APF, stay engaged with the mentors that taught you. Always be grateful for people who make these, opportunities possible. And as mentors, I feel that I am incredibly grateful to learn from such width of information. So with that, thank you for allowing me to be part of this this whole process and journey for so many. And with that, Hania, back to you.
Thank you, Dr. Uzma. We will be talking next to Dr. Sara, who is the CEO and founder of Sehat Kahani and has done incredible work. And through this process, I've also learned more about the work you've been doing. And can you please share what it means to you to have the APF partnership? Please, the floor is yours.
Thank you, everyone. And I'm so honored and glad to be here yet again for another presentation of the fellows. So my name is Dr. Sara Said Khurram. I'm the CEO and co-founder of Sehat Kahani. It's a digital healthcare platform that creates clinics in low-income areas enabled through telemedicine, and also an app for urban areas for corporates and consumers. This is our, this is a fourth year with the APF Fellows, and every year I think I'm just inspired and stumbled and bowled over by the quality of fellows that we have received. And the people who've come in and done work with us, whether it was through a research fellowship or previously through marketing and creative storytelling. But this year, having Alicia, Naila, and Hamna was an absolute pleasure. They carry such an experience themselves of research that even it was a lot of fun and learning for our team working with them. I think we were able to pull off 3 incredible and very important researches that you will hear when you hear their presentations, but they're structured around some extremely important questions that we should all be asking in the public healthcare system of Pakistan. I think whenever the speaker sessions happen, which is a flagship part of our APF fellowship program, we try to arrange a speaker session every 15 days. And as always, this time when the speakers gave their feedback, their first and very important feedback was, what amazing questions. The quality of questions that these girls asked really, they had to ponder up to give the answer. So I think that tells about the quality of the fellows that come across. I think as Dr. Uzma said, this is a relationship for life, and we continue to be involved with these fellows. We continue to, we actually encourage them to publish their researches and continue to keep working with Sehat Kahani. A couple of them have done that. And I think now as we move forward, I think this is now, as Dr. Uzma said, becoming a community. Even we've hosted over, I think, around 10 fellows now, and I would love to see if we can bring them together through a virtual Zoom call so they can all keep connecting to each other, because I absolutely echo what she said, that this is a community, and everywhere in the world where fellowships are done, I think that community feeling is extremely important. So as always, we had a lot of fun working with them in their researches. You'll see some amazing results and findings that they will explain to you. But I thank APF for the opportunity, for providing us with these amazing individuals year over years that help us really solidify, quantify the work that we're doing at Sehat Kahani. And I look forward to another year fellowship, and also hopefully, maybe hosting some of them in person as we move forward. I know that's a discussion we are happening, but until then, I mean, I'm extremely honored to be a part of this program and of this community. And I think for all the fellows here, you're welcome at Sehat Kahani virtually and physically, anytime you want, anytime in your career. We love to keep working together with all of you. You all were amazing, and we had so much fun.
Thank you so much, Dr. Sara. Uzair, would you like to speak about Atlantic Council? Uzair Yunus is the director of the Pakistan Initiative at the Atlantic Council, and this is our second year doing a fellowship partnership with Atlantic Council. So Uzair, please share a few words with us. I will ask to unmute.
Okay, can you hear me?
Yes.
Yes, okay. Well, thank you, first of all, for this opportunity, and thank you to the APF for the continued partnership with the Atlantic Council. I am director of the Pakistan Initiative at the Council, and this is our second year having a summer fellow with us doing research. And before I, just share a bit about the wonderful research Umair has done, just at a personal level, why this is so important to us is going back to my own early career. When I was in grad school back in 2013-14, beginning to work in policy, it was very difficult coming into Washington and wanting to do research as a rising scholar to find a place where one could do that kind of research. And I think the APS partnership with the council really has filled that gap that I personally experienced and many rising scholars experience, where you're kind of tied in with research in terms of where you work, and that space is not there for you to drive your own research. So last year, with our partnership, we had Hamna, who wanted to focus more on the technology sector. She published her research on that. And Omer this year wanted to look at climate change and youth. And it was very important for us to give that space and do that research primarily given the backdrop of the 2022 floods. So I think it's a critical space we're filling in Washington, where many of the ongoing programs or focus areas on Pakistan really take a very narrow look at the country from a hard security or radicalization or violent extremism point of view, which are important issues, but nonetheless, there is much more of importance in Pakistan that needs to be researched. So we were very excited with the work Omer did and with the folks in Pakistan. He was able to connect with to get input on, well, what needs to change on the climate side conversation in Pakistan, particularly around youth and the role that they need to be playing in policy making, in conversations, in building institutions and research on this topic, because, you know, let's be honest, they will be the generation that has to deal with the climate crisis that already is affecting the entire globe. Many of you may have already seen this week, for example, Greece get impacted by devastating floods as well. So again, thank you for that partnership. Thanks to Mayor for the wonderful research he's done. What the findings are in the next few days. We will be publishing that full research on our website, so I will share it with everyone once that goes live, and look forward to continuing this partnership with the APF next summer, and maybe even having more than one summer fellow do research, again, driven by them on topics that excite them the most. So thank you for the partnership and for the opportunity.
Thank you so much, Uzair. With that, we are now ready to hear from the first fellow of the day. So we're going to start with the Sehat Kahani Fellows, starting with Alisha, then Naila, and then Hamna. And then lastly, we will move to the Atlantic Council Fellow, Omer. So Maha, could you please give Alisha the floor and the screen share?
Sure, Elisha, the floor is yours, and we can now see your presentation.
Okay,
Wonderful.
perfect. Sounds good. All right. Well, good morning, everyone. Good afternoon. Thank you so much for joining us today to hear from myself and the other fellows on our work this past summer. My name is Alisha Siddiqui, and I am a recent Yale graduate. I studied political science and global health. I'm planning on pursuing my master's at the University College London in Population Health Sciences this upcoming fall. And I had the honor of working with APF Sehat Kahani as a fellow this past summer. My research topic that I'll be delving into today is on evaluating health-related barriers and interventions in Sindh, Pakistan, using a qualitative study based on the Sehat Kahani model. So we're going to just go ahead and start off by discussing some motivation to studying barriers to health. So for those of you that aren't necessarily as invested in the healthcare field, I wanted to give a bit of a layout as to why studying barriers and interventions matters so much, particularly in the context of Pakistan. So first, sociocultural determinants of health actually have a greater impact on health than genetic factors. And when you think about that in the long term, that's a huge impact. Secondly, cost of care is a huge barrier in Pakistan, which often prevents a huge population from receiving adequate and appropriate care. Approximately 2/5 of the population of Pakistan is uninsured, and many hospitals have now become privatized, which has led to skyrocketing prices as well. Finally, a lot of literature and a lot of the politics and history of Pakistan have unfortunately shown a lack of investment in the healthcare sector. Many government-owned hospitals lack funding, lack resources, and are often overcrowded. And I felt these three reasons were important enough to substantiate a thorough, in-depth research project into barriers and interventions in Pakistan. Which leads to my research question and aims. This past summer, I studied two main questions. The first was, what are prominent barriers to health faced by marginalized groups in Sindh, Pakistan? And the second was, how does the Sehat Kahani model sustainably and effectively address these barriers? Dr. Saeed Khurram gave a bit of an introduction into Sehat Kahani, but specifically I wanted to look at the telehealth, the cost, and the physician's aspects of the Sehat Kahani model to evaluate. So why Sindh? Sindh is home to 25% of the population of Pakistan. It also constitutes 37% of Sindh's population being rural, living under the poverty line, and almost 70% of Pakistan's entire population is rural. I wanted to look at geographical barriers as well as poverty barriers. Previous research has correlated high income with better health outcomes, as well as urban areas with better health outcomes. So Sindh would be an optimal setting to look at marginalized populations specifically. Leading on to my timeline, I conducted my research in 3 phases. The first phase was a thorough literature review, followed by 2 phases of qualitative level interviews amongst patient and providers. And my qualitative data collection and recruitment ended up in 5 provider level in-depth interviews and 5 patient level in-depth interviews. The inclusion criteria for this study was patients from rural settings who had been associated with Sehat Kahani for at least 2 years, who are either a female doctor or a female patient. Informed consent was collected prior to and during the study, and interviews were conducted predominantly over Zoom in Urdu and later transcribed to English. And with these, we conducted a thematic analysis to gauge for specific reoccurrences and perceptions and ideologies regarding health and barriers. A few limitations I want to consider and throw out before I delve into the research itself. This is a small sample size, considering the nature of this fellowship being as brief as it is. However, I do think we were able to gauge a lot of data that was really critical for understanding the landscape of healthcare in Pakistan. And secondly, the study was conducted predominantly as a qualitative review. However, the study could be strengthened in further ways by becoming a quantitative analysis as well. And I would encourage you to take a look at that if you're interested in that, to reach out as well, because I would also like to be involved in the quantitative aspects of this question as well. So from there, we can start off by talking specifically about the findings from my literature review. I found 2 main ideas presenting in the literature review. The first was regarding socioeconomic and geographical barriers to care. There seems to be an unequal access to resources and unequal resources in general in Pakistan, as well as a lack of minorities in health planning and policy, and a poor quality of health information and management systems. Secondly, as I mentioned earlier, the recent privatization of healthcare services has led to increasing costs of care. Considering all of these factors, with the idea that rural patients are often deterred from receiving adequate care due to distance from clinics, these were 2 considerations I wanted to take in hand when conducting my interviews. Secondly, regarding gender stereotypes in the Pakistani medical field, there seems to be a bias against employing female doctors specifically, and a social stigma around accessing care if a patient were female. So these were 2 considerations that I wanted to integrate into my qualitative level analysis, which I was able to approach and later conduct a thematic analysis on. I probed questions on barriers relating to healthcare access, followed by an intervention that patients or providers felt the Sehat Kahani model had effectively used to address these. The first barrier many felt they had experienced was a lack of trained healthcare doctors, and patients and providers alike felt the Sehat Kahani model had raised awareness through their educational modules, as well as access to female doctors, which was an extremely important factor. Another barrier, as I mentioned earlier, was the distance from clinics and the cost of travel of care. And telehealth services significantly reduced these costs, as well as the cost of time that many patients felt they had experienced. Finally, as an overarching sort of theme that I wanted to consider, there seemed to be a lot of inequities prevailing in the healthcare sector in Pakistan, and many patients felt that the higher quality of care they had been afforded by Sehat Kahani was able to allow them to not only gain more trust in their providers, but trust in the knowledge they had acquired as a better patient, as a better, healthier individual. So just to give you a sort of even more in-depth microcosm lens into some of the quotes that I had from my patient qualitative interviews, patients felt that they were better equipped. They felt they had more affordable prices, and they had received guidance on how to address issues, including contaminated water, with the necessary medications. Another patient felt that when there was a shortage of female healthcare providers, Sehat Kahani had bridged that gap, and thus they felt more comfortable discussing their healthcare concerns. Finally, another patient felt that they were able to connect with qualified doctors from nearby clinics, which was also incredibly convenient. And I want to point out that these are all findings that are conducive and correlative with our literature review findings as well. In the lit review, we felt that patients had, again, issues with the lack of female healthcare providers, the distance to clinics, and even the guidance given by physicians. And the Sehat Kahani model was actually tackling these head on. Secondly, looking at quotes from provider qualitative interviews. So providers felt that they were able to provide services 24/7 to patients, even in remote areas, on topics related to infertility, gynecology, and mental health. And for those of you that are a bit more familiar, these typically tend to be sort of stigmatized healthcare topics. So it's interesting providers specifically pointed out these. Secondly, there was a quick accessibility of general practitioners with doctors who held degrees and could provide better guidance. And they felt that Sehat Kahani had been instrumental in assisting them in their treatment of patients as well. Again, these all correlate with the literature review findings. I think it's particularly interesting that physicians felt there were better physicians because of the Sehat Kahani model, which extends onto the sustainability impact of this organization. And I just want to wrap up here by talking a little bit more about extending impact beyond borders. The main objective of my research was to look and acknowledge sociocultural barriers, and Sehat Kahani has been able to intervene and adopt interventions that are extremely beneficial in this scheme. However, as Pakistani Americans, I do think it's our role and our duty to use our platform to raise awareness and invest in organizations like Sehat Kahani if we aren't able to travel to Karachi directly. I'm sure many of you are familiar with the statistic that Pakistani doctors contribute to the third largest amount of foreign doctors in the United States. Not a surprising statistic to me, but I think this also mandates that we have the resources and the capabilities to invest in Sehat Kahani. And we should also place a greater emphasis on culturally competent models, whether that's through education or integration of these techniques into the care offered on the ground or abroad. And without studying impact, healthcare in these vulnerable and marginalized populations will continue to deteriorate. So I hope you take these considerations from my study and are able to perhaps integrate them into your own care that you provide to patients or in your own understanding of the healthcare scheme in Pakistan. And I want to wrap up by just offering some acknowledgements to both the Sehat Kahani team and APF. And I encourage you to take a look at the APF collaboration with Sehat Kahani to see ways that you can perhaps be involved. I feel this fellowship has done wonders and allowed me to gain a huge understanding into what healthcare in Pakistan really looks like, even from my home in Oklahoma, which speaks wonders to the Sehat Kahani team and the APF team on sort of leading this fellowship out. So that I will include. Thank you for taking the time, and I apologize. I know I might have gone a few minutes over, but I'd be happy to answer any questions or speak further.
Thank you, Raisha. We will take maybe questions at the end, but we want to make sure we have enough time for all the fellows to present. Great job, really enjoyed that. And thank you for all the hours and hours of work you've put in. Dr. Sara, you had your hand raised for a second, or did you want to say something?
No, I was finding an emoji of.
Oh, okay.
Apologies for that.
Wonderful. Yes, amazing. Thank you, Alisha. Up next, we have Naila Khan. Maha, if you could just give the same view. Thank you.
Yours.
Can everybody see my slides? All right, wonderful. So hello, everyone. Thank you all for being here on your precious Sunday. My research topic is exploring the impact of telemedicine on access to birth control in rural and urban Pakistan. So my name is Naila Khan, and I am based in California, where I currently practice a hybrid of hospital and outpatient prison medicine. So we'll just get started here. Now, the COVID pandemic didn't have many upsides, but one of them was the growth of telemedicine worldwide, with many benefits ranging from health economics to improved clinical outcomes. Both patients and clinicians are overall pretty satisfied with this new approach to healthcare, and this is no different in Pakistan. So just as a review, Pakistan's population exceeds over 200 million, and it is the 5th most populated country in the world. This is in part due to improved sanitation and public health, but also a failed system of family planning. So contraception is one key solution as it prevents unwanted pregnancies and abortions and overall decreases mortality. To my knowledge, there were very few studies conducted to explore the topic of telemedicine in parallel to reproductive health in Pakistan simultaneously. So there is a lot of potential for research on this topic. There were a few questions at focus, with the main ones being to determine perceptions, along with barriers and facilitators influencing decisions to access birth control via telemedicine. And my hypothesis was that telemedicine could be used to provide this care in both rural and urban settings. So the study design consisted of quantitative research that was conducted in Sehat Kahani clinics in urban Karachi, as well as 3 rural towns. We conducted one-on-one interviews, mainly using 2 validated questionnaire tools. One was to assess contraceptive intent, and the other for telemedicine perceptions. Informed consent and ERB approval were obtained prior to the study. The questionnaire was, of course, translated to Urdu, the target language of the population. And to incentivize participation, they did receive some refreshments post-questionnaire. And the inclusion criteria consisted of married females between the ages of 15 and 49. So very briefly, a few socio-demographic characteristics. The study included a sample size of only 39, with a median age of 30. Most resided in rural areas and were of Punjabi ethnicity. And the average distance to the nearest hospital was about 4 kilometers. Most participants were unemployed, despite 50% having attended college, and the ideal number of children desired was averaged at 2.8. 46% were actively using birth control at the time of the questionnaire. Now, for the sake of time, I'll highlight just a couple of few relevant findings, specifically comparing the rural and urban responses designated in different colors here. So first, focusing on the results from the contraceptive intent questionnaire. When assessing milestones prior to having children, so this could be things like finishing school, establishing a career, this was almost equally important for women in both the rural and urban settings, which I thought was pretty interesting, as you can see here. Partners against contraception. So half of the rural population, right here, about 50%, believe that their partners were against them using contraception. While as you can see, this was not so true for the urban participants. So this is pretty consistent with the known literature supporting existing sociocultural barriers in certain regions of Pakistan. Wanting to avoid pregnancy now. So the majority in both settings felt it was overall either very important or important to not get pregnant at this present moment. You can see that here and here. Corresponding to that, both populations believed it was equally very important to be using contraception at this time, in about 40% in each setting. So it's very important here. And when it came to planning for the next pregnancy, the urban population was willing to delay this up to 2 years, whereas the rural population was more inclined to having their next pregnancy sooner. Now, I do want to point out that there was a notable knowledge gap regarding contraception use and awareness in the rural population compared to the urban folks. For instance, half of the rural population believed that they would have a hard time using birth control correctly and believed it would cause more harm than good. So the last part of the study involved asking if patients would be willing to get contraceptive care, specifically via telemedicine, like the Sehat Kahani platform. And the overwhelming majority were agreeable at about 80%. The top 2 reasons people cited were for privacy and then convenience, followed by access to more counseling and education. Specifically in terms of engagement methods, they didn't really care if it was a video or a phone call, but there was a strong preference for a female provider. Discussion and implications. So the data collected does overall support our hypothesis that telemedicine can be utilized to provide contraception and counseling. The findings in this study are consistent with the literature, which points to an unmet need, despite there being an intent for contraception. The study also highlights the disparity in family planning in rural populations, and so implementing telehealth may provide access to bridge those gaps. The limitations that do need to be accounted for include a very small sample size, given the short study duration, and the presence of a language translation and selection bias, all of which do undermine the internal and external validity of the study. Recommendations for future studies would be to survey healthcare professionals to get their perspectives, training providers for standardized reproductive care methods and protocols, determining if contraception use is influenced by the gender of their existing children. For example, will they avoid contraception altogether if they want more sons? And lastly, exploring different types of contraception and how those can be implemented remotely, for example, pills versus implants, etc. So conclusion and our take-home points for today. It is established that there is inadequate access to contraception in Pakistan, especially within the marginalized and less urbanized communities. Fortunately, there is an overall positive attitude towards telemedicine. And with proper implementation, funding, resources, and awareness, telemedicine can be optimized to provide reproductive health, with the benefits of improving maternal and child health, promoting women's wellness, gender and income equality, economic diversification, all while curbing poverty to create a better Pakistan. And with that, thank you for the mentorship and the opportunity, and I hope to collaborate again in the future. Thank you all for your time.
Thank you so much, Naila. That was all very, very interesting. Maha, do we have enough time for questions, or has Naila used up all 7 minutes?
Naila did use up all 7 minutes, but we do have time at the end for questions.
At the end. Okay.
Yes.
Before we move on to Hamna, I just want to recognize that in our attendees, we have the other co-founder of Sehat Kahani, Dr. Ifat Zafar. Just wanted to give a shout out. And if Dr. Ifat would like to speak, we will open the floor to her as well at the end. Now, Hamna, over to you.
Okay, so I will be sharing Hamna's presentation, and can everybody see my screen?
Yes.
Yes.
Okay, perfect. Over to you, Hamna.
All right, perfect. Thank you, everyone. Well, first of all, good morning, good evening, and assalamu alaikum, everyone. Thank you so much for attending today's presentation. My name is Hamna Kol, and I will be doing my presentation on evaluating the impact of telemedicine mobile units on healthcare outcomes, healthcare systems resilience, and disaster response in flood-affected areas, a case study of Sehat Kahani. Next slide, please. So introduction, when natural disasters strike, access to healthcare services can be severely deprived, leaving vulnerable populations with significant healthcare needs and interventions. However, traditional health systems response must catch up with the demands during disasters. And this study investigated the use of telemedicine services through mobile units during flood emergencies, and how these services improve health outcomes, reduce mortality rates, and enhance healthcare system resilience in disaster-affected areas. To meet the needs of the population, Sehat Kahani first implemented physical camps and then developed a two-tier telehealth model. The physical camps allowed Sehat Kahani to set up in an area that was affected and offer one-on-one medical assistance. And then they transitioned into a more telehealth unit. They provided mobile units, a van that traveled across the affected areas, providing awareness and understanding of healthcare and ensuring patient access, outcomes, and experiences. The telehealth application allowed current and new users to connect with doctors and specialists in minutes for consultation purposes. Next slide, please. So this pie chart shows the demographic breakdown in the province of Sindh. The mobile units travel to 12 districts, 26 palaces, and 86 villages, helping a total of 25,702 people, majority of them being women and girls, followed closely by men and boys, and then elderly women and elderly men. Next slide, please. So the methodology, semi-structured interviews were conducted via Zoom and email with key stakeholders, including Sehat Kahani staff, healthcare providers, beneficiaries, funders and donors, CEOs, or other top-level management at Sehat Kahani. Next slide, please. For the findings, there were a total of 10 main findings throughout the research, but I wanted to concentrate for this presentation purposes on five key ones. The first one being the healthcare needs and telehealth services, the importance of comprehensive assessments, budget analysis, and collaboration with government agencies, community organizations such as colleges and mosques, and corporate partners like Lifebuoy and Zong. The second being accessibility concerns in telehealth services. So Sehat Kahani's multi-tier model combined mobile clinics and a one-window application, which allowed them to remove the barriers to care, meeting the community needs. And Sehat Kahani also collaborated with mosques and community elders to share resources, and also deployed healthcare providers from that region who spoke the dialect of the region to go out into the community and spread the word. Security and privacy confidentiality, so safeguarding patient information and data protection regulations were implemented, like HIPAA, but also Sehat Kahani implemented doctor-patient confidentiality in physical clinics and mobile units through spatial separation through curtains. Effective training for healthcare professionals was also provided, online training programs emphasizing empathy, rapport, and technical proficiency for healthcare providers. And Sehat Kahani had a constant stream of doctors trained every 15 days. By continuously training and updating healthcare professionals, they ensured the readiness of their team and utilized healthcare technology effectively in the disaster situation. Next slide, please. Okay, and then managing the surge of patient volume. So Sehat Kahani's scalability measures and preparedness for increased patient volume ensured effective telehealth services delivery during disasters. Next slide. Now I want just to touch quickly on the importance of the two-tier model. So the mobile units were allowed healthcare providers to reach underserved and remote areas. They also allowed healthcare providers to do screenings, vaccinations in the remote and rural areas, mobilizing and customizing based on specific needs, and providing immediate care and transported critical cases into healthcare facilities if necessary. They also facilitated face-to-face interactions between the healthcare providers and patients, fostering trust and communication, and going to new areas as needed. Whereas the app ensured accessibility and on-demand healthcare services, such as medical consultations, information, and support. The application also allowed for healthcare services, including routine checkups, chronic disease management, mental health support, and health education. It also streamlined the healthcare process by reducing administrative overhead, offering digital health records, and ensuring remote monitoring of chronic conditions. It also engaged the patients through educational content, appointment reminders, and health tracking features. And because of this application, it seems like the user base is growing within Pakistan, and it is leading to more development in the healthcare sector. Next slide, please. And these slides are just visualizations in terms of how the mobile units were on the ground offering assistance. Next slide, please. And I wanted to share two case stories with you, talking about the mobile clinics and also the app. So the first case story is about an 11-year-old girl that Dr. Kurum actually shared with me. This young girl was affected by deep floods. Her family and her walked for days and days out to get to land where they could be well settled. This young girl had cuts on her feet, and her feet were infected with maggots. Upon reaching the mobile clinics, doctors provided the young girl with the necessary treatment, removing the maggots and the dead tissues, and providing antibiotics. The next case study talks about the telehealth application. A young man had a bad cough for 2 months, but didn't have the time to go see a doctor. His friend recommended Sehat Kahani's app. Upon using it, he connected with the doctor in minutes, described his symptoms. The doctor pointed out that it might be tuberculosis and recommended getting tested. Using the booking feature on the app, he scheduled an appointment and found out it was tuberculosis. Next slide, please. Okay, so I want to touch on the importance of disaster relief telehealth. So the topic of disaster relief telehealth is important to the Pakistani community and the Pakistani American diaspora for several reasons. One being vulnerability to natural disasters. Pakistan is prone to various natural disasters, including earthquake, floods, and droughts, leading to widespread devastation and a need for immediate medical assistance. For disaster relief, telehealth can provide timely access to healthcare professionals and resources, especially in remote and hard to reach places. The second is the diaspora to engage. The Pakistani American diaspora often maintains a strong ties with their home country and is actively involved in philanthropic efforts to support disaster relief efforts. So through the telehealth initiative can provide a channel for the diaspora to contribute by volunteering their medical expertise or supporting telemedical infrastructure and development in Pakistan. Next slide. The third is resilience and preparedness. So disaster preparedness is critical for any community, and the telehealth feature can help in a pivotal role, playing a pivotal role in enhancing a community's resilience, educating both the Pakistani community and the diaspora about the telehealth options during disasters, can empower them to better prepare and respond to emergencies. And lastly, advocating for telehealth development. The diaspora can advocate for the development and improvement of telehealth infrastructure and policies in Pakistan. This can be used for to influence and resources to support supporting expanding telehealth services during disasters and in regular healthcare delivery. Next slide, please.
Hamna, I also want to share you're running out, or you have run out of time. So just
yes,
if you can.
Yes, I'm just almost done. This is the limitations, and then I will just really quickly go over these. Thank you. So in terms of limitations, sample size was a big one. The study sample size may be limited due to specific nature of the disaster event and the availability of key stakeholders. Selection bias, the case selection process and availability of participants may include selection bias that I was only able to interview a handful, and generalizability. The research focused on the Pacific disaster events in Pakistan in 2022, so the findings may not be generalizable to other disaster scenarios, regions, or population with different healthcare infrastructures. Next slide, please. And then conclusion. So this case study of Sehat Kahani illustrated the success of integration of healthcare telehealth in disaster relief efforts. Their comprehensive approach allowed them to have resource analysis, accessibility, security, scalability, training, evaluation, collaboration, and and sustainability. And this is a vital model to implement in future disaster relief efforts. Next slide. And I just want to quickly acknowledge Sehat Ghani and American Pakistan Foundation for this amazing experience. Thank you so much.
Thank you, Hamna. Lastly, we will hear from Umair, who is the fellow for Atlantic Council. Umair, please take the floor.
Assalamu alaikum and adab, everyone. I hope your morning is going well. So yeah, thank you for the introduction. My name is Omer Naeem, and I essentially was trying to make the case for Pakistani youth-led climate adaptation initiatives. But before that, a little bit about me. I am a senior now at Washington University in St. Louis. I study international affairs, Asian American studies, and Urdu, and I'm conducting research in the humanities and social sciences on expressions of Pakistani national identity in both the British diaspora as well as the American diaspora, with a particular focus on communities that had migrated out of Pakistan during the Zia regime. So happy to talk about that at any point if anyone's interested. But yeah, moving to what I did this past summer, I was working with the Atlantic Council South Asia Center, specifically their Pakistan initiative, on both administrative tasks as well as research. I joined the Atlantic Council at a bit of a time of transition, to say the least. It was a really dynamic time to be engaging with the council or the center and the Pakistan initiative in particular. So while at the council, I was simultaneously working on a research project as well as administrative and functional tasks. But for my research project itself, I was trying to address and look at how to convert Pakistani youth-led climate organizational needs into American opportunities of policy interaction. So the project actually looked at the consequences of climate change in Pakistan, current initiatives that are in place, a top-down approach to climate change, the why behind youth engaging in adaptation, the role of the provincial, the tehsil, the district, and the federal government in moving forward, as well as implications for the US-Pakistan relationship, where it's at and where it can head. And ultimately, I provided several key recommendations in moving forward, such as a broadly societal level recognition of climate change as Pakistan's greatest existential crisis. And I really wanted to emphasize the role of the elderly in this. A lot of power in Pakistan, despite the vast majority of Pakistani population being young or under 30, they're not necessarily represented well in politics and policy spaces, as well as just industry level engagement. So essentially, older people, they must make the space for the future of leadership in Pakistan. And ultimately, also promoting a broad level of transnational collaboration across low and middle income countries, especially in the context of climate change. So again, why is this important? Again, climate change is like the most existential crisis to not just Pakistan, but all nations across the world. And given that the vast majority of Pakistan is young, it's critical for them to feel empowered about their future. And this is exactly why I engaged in this sort of research. Youth don't feel a strong sense of agency. I held several conversations with current Pakistani youth climate adaptation activists and organizers and nonprofit starters, and they all came to me with the same sort of sentiment that they don't feel like they have actual space to contribute meaningfully. And this is a critical space that we all need to acknowledge. Even, of course, myself as an American Pakistani, recognizing your positionality in the work that you're engaging in. For there to be meaningful work and meaningful engagement and moving forward, we need to recognize that we don't necessarily always have the solutions at hand, but we can contribute by putting the people who have the most at stake in conversation. So again, some challenges with the research and the fellowship itself. There was limited on-site staff given the period of transition that I was working with. And so that basically entailed a lot of multitasking, juggling the administrative tasks and needs of the South Asia Center while simultaneously conducting my own research and conducting interviews and such. While simultaneously, that was an opportunity for growth for me. And additionally, the timeline. I feel like already, now that I'm starting the semester, I'm trying to commit myself to doing research by myself at school, and it's tough to complete research over a summer. I'll say that. I feel like this is something that could definitely be that should be considered more strongly in a longer format, but the time constraint was definitely a challenge, to say the least. So the lessons I've learned throughout this process, both research and administratively, it's really integral to build strong relationships early on, whether that's for me, that was through both the Atlantic Council, but also through the people that I was connecting with on the ground in Pakistan. Having people recognize you for more than just your work, but a name, a story, a face, it changes the way that you perceive work. It becomes part of your narrative. And that for me was really, really important. And I really learned a lot through the relationships I built. This wasn't necessarily a lesson I learned, but something that I really contextualized. Industrialized nations like the US must equitably contribute to climate change adaptation initiatives. We hold the burden because we have contributed the most, and that's point blank period. And through this process, I came to the conclusion through exhaustive conversation with a lot of actual Pakistani people that it is a shared responsibility, and we must view it as such. And finally, we need to communicate in ways that resonate with our audiences. So with a lot of climate change literature in Pakistan, it's primarily available in English. A simple fix to making climate change education and knowledge sharing more accessible is, as a start, translating things into Urdu, and then from Urdu to, your regional languages, Punjabi, Saraiki, Sindhi, Pashto, etc. So it's integral to recognize the biases and the limitations that language itself can play. So implications for my career, this experience has been extremely fundamental in how I'm shaping things moving forward. I haven't really ever had experience in a think tank capacity, specifically looking at Pakistan. And so this has definitely honed my interest in working more on the academic and policy side of Pakistan-US engagement, and more explicitly climate change and youth focus. So moving forward, where am I headed from here on out? As I said earlier, I'm in my senior year of university. I am currently applying for programs in development studies. I'm also looking at University College of London. So I noticed someone said that earlier, but predominantly I'm looking at institutions in the UK. I feel like as an American Pakistani, I've learned so much from the community here, and I only see myself learning more from engaging with other Pakistanis, both at home in Pakistan and abroad and the diaspora. So finally, I'd like to give a huge thank you to not just the APF and the Atlantic Council, but to the people who helped me on the ground in Pakistan: Dr. Aram Haider, Mishak Paul, Zishan Salahuddin, Zahar Samad, Kapil Sharma, Mal Kamal, Rida Rashid, Uzair, of course, Anam Zaid, and Zainab Zahid. These individuals invariably contributed to my work and are helping me move forward and keeping this conversation going. But yeah, thank you so much.
Thank you so much, Umair, for all your work. Now we are at 12, but whoever wants to stick around, we will be doing the questions now, and Hassan will be taking over and walking us through the questions that have been sent on the chat. Hassan, are you there?
Yes, I'm here. Can you guys hear me?
Yes.
All right. Thank you, everybody. So first question is for Elisha. And these questions are also posted in the panelist chat. So if you guys want to look at ahead of time, that's fine as well. So marginalized communities face similar barriers to accessing healthcare in the US as well. How would you evaluate the similarities, these barriers for US healthcare, and publish this analysis? And how would you plan to do this?
Thank you so much. So I can give a bit of my background to perhaps provide an answer for this question. I've worked in research for the past 3 years at the Yale Institute for Global Health, and one of my particular interests has been in social mixing patterns. So the question of barriers to health has been of my interest for quite some time now. I think the best way, what I've seen in practice to elucidate these barriers, is through in-depth interviews. And I think they've been really beneficial through the Sehat Kahani model, the fellowship that I was able to conduct these through as well. But in practice outside of APF, outside of Sehat Kahani, I've been able to work in maternal settings, particularly looking at barriers to maternal immunizations, for example, in women and children. And I think that's been really beneficial. But honestly, sort of looking at this in terms of replacing the term marginalized with Pakistani, for example, not to say that there aren't Pakistani Americans who aren't of a marginalized demographic in the United States. I think it's really interesting for us to perhaps take a look at barriers that present specifically in Pakistani communities in the United States, a sort of a diaspora study. And so I mentioned earlier, I will be going to London this following year, and that's something I plan to do in the UK, considering the large population of Pakistanis there. But I do think it's a study. Sorry, I don't know if I'm cutting out a bit, so I apologize for that. Can you hear me? Okay. Okay, perfect. So I was just mentioning that I think considering the growing population of Pakistani Americans here in the United States, it would be really interesting to probe specific barriers in our communities. For example, as I mentioned earlier, I've conducted this research in maternal and child settings, but I've also been fortunate enough to conduct this research in Pakistan, looking at RSV mortality in Karachi in a study, again, with Yale through Aga Khan as well. And something interesting we found there, as an example, was that in Karachi, the only way that postmortem autopsies could be performed was if there was a fatwa given through the local masjids. And so something like that is extremely instrumental in understanding the landscape of perceptions in Pakistani individuals. And I think that's something we can apply certainly here in the United States as well, and take a deeper look into what those barriers might look like for Pakistani Americans. So I appreciate that question, and hopefully we can see through a study that can accomplish that in the future.
Thank you, Elisha. Appreciate it. All right, the second question is for Hamna.
I think the second question is for Naila.
Sorry, yes. Delaying childbirth and limiting the size of the family relates to direct economic impact. How would you like to continue working on this project, and would you like to publish it?
Yeah, thank you, Dr. Iqbal, for that question. So this topic actually aligns very much with my personal interests, like curbing poverty, promoting women empowerment, and focusing on correcting like underlying systemic issues in Pakistan. And now combining that with the growing impact of technology. I practice telemedicine myself, so I understand how that works. But something that's on my immediate to-do list is actually stick around post-fellowship with Sehat Kahani. And I've connected with the team, and they've been nice enough to let me do so. But I would like to actually spend more time to collect more quality data, and doing this by increasing the sample size, surveying like more clinic locations, and expanding on the questions to make this a publishable study and hopefully a reputable journal. So that's the goal.
All right, thank you. Question number 3 for Hamna. Thank you for the important work. Each fellow work is unique, but connects at its core. Would you consider collaborating with each other for ongoing work on these important issues and publishing the work?
Yes, thank you so much for the question, Dr. Iqbal. Definitely. I mean, I'm completely open to it. So if my fellows would be interested in collaborating, I'm more than happy to.
All right. We got another one. We have a few minutes, right? All right. Adab Umair, how would you envision staying connected with the youth, emerging APF and Pakistani American diaspora leaders to continue your work and increasing your impact?
So thank you for the question. So first of all, I think it's integral to build active networks and communities. So I don't see the work ending with this fellowship. If anything, this was just a continuation of the work that I already set out on. Last summer, I had worked with the State Department on their Bureau of South and Central Asian Affairs, and I had the opportunity to connect with the Pakistan Embassy in DC. And through that, in and of itself, I met a lot of the people who I'm having conversations with throughout this fellowship, and also am continuing to plan on having these conversations with. Which is to say that I plan on staying in community. I think more than anything, we need to really value each other as individual people and our stories, and we have a lot to learn from that. So In terms of staying connected, I think by having these sort of consistent avenues and spaces to talk, and also staying in the same sort of industry, or for me, I guess, staying in these policy circles, staying in conversation, showing up to different events when the nexus of climate change, security, and youth in Pakistan is being addressed. I think by showing up, I'm going to be contributing to continuing that conversation. But more than that, I'm going to try to further extend the impact by actually talking with and valuing the experiences of the Pakistani people who have the most at stake. Again, I think recognizing my positionality as an American Pakistani, like I do have limited, a limited perspective in the sense that I'm passionate about this work, but I'm not necessarily the subject of it. So continuing the conversations, I think that's going to be the resounding theme of my work moving forward.
Thank you very much, Umair. With that, I don't have any further questions that were asked. I do have one of our board of directors at APF wants Umair to reach out to him. So I'll drop Umair a note with an email address for you. Feel free to reach out to him. And that's all.
Thank you, Hassan. Thank you, Umair. Before we go to Dr. Nasser for the closing remarks, I just want to share that Dr. Ifat Zafar is with us. Dr. Ifat, would you like to share a few words? Dr. Ifat is the co-founder with Dr. Sara of Sehat Kahani.
Hello, Hania. Thank you so much.
Hi.
Can you hear me?
Yes, we can hear you.
So I think I'm really excited. All the researchers were amazing, and I think there was a lot of learning that they all shared. And I think I really love the overall sentiment that the American Pakistani Foundation brings in ensuring the younger generations are kept connected to the roots and are connected to Pakistan. I think that's the really important work that they're doing, because I think this is something which I believe the media has failed to do in really sharing the positives coming out of Pakistan. And I think APF has done that beautifully. So really kudos to the entire APF team and making sure the new upcoming generations are kept connected to Pakistan. And yeah, I think really seconding Sarah's sentiment, would love to have all the fellows visit Pakistan someday and visit Sehat Kahani office. And yeah, welcome to all the other APF fellows and members and directors as well, that whenever you are in Pakistan and in Karachi, please do drop by, come to our office, have coffee with us, and get to see the work on ground. Would love to have that all. Thank you.
We would
again.
love that. We would love that. Thank you so much, Dr. Ifat. And now to close today's presentation, may I invite Dr. Nasser to share a few words and call it a day.
Hania, there's another question in the chat.
So then back to Hassan.
All right. At a recent conference, we spoke about the same issue, that language barrier impede the one of the major points was indeed. Is this a general question or specific to somebody? I'm not sure. Maybe it's for Umar. One of the major points was indeed about translating research journals and technical reports. I wanted to ask about why there isn't a community that is already doing translations like these, and how would we begin to facilitate transfer of knowledge that is already available in English?
Yeah, I'm definitely, thank you for the question, and I'm happy to respond in the limited way that I can. So I definitely know that there are some, not necessarily even communities, but there are institutions. For example, the Ministry of Climate Change in Pakistan, the work that it's doing, they have essentially made efforts to translate some existing climate change knowledge and education modules to Urdu. But it's just a lack of resources, really. I mean, people, first of all, the people who do have resources or who are able to translate things from like English to Urdu or English to a regional language, they don't feel like there's an incentive for them. And for the people who also have those language skills, there's just not the baseline level of why it's important to translate that. So I guess for the question of why there isn't a community, it's because climate change also still isn't taken as seriously as it really needs to be. But just generally when it comes to research journals and technical reports, I think the ongoing like pedagogical shift is towards English just generally. So again, in the limited the sphere that I can respond to that's just been my experience.
Thank you, Umair, and thank you everyone for sharing your questions. Hassan, is there anything else you want to cover?
No, I think we're good.
Okay.
Just want to thank everybody. Thank you, Hania, so much for doing a great job. I know it was a lot of back and forth and just putting everybody together in a specific time, but that was a hard task to do. So thank you, everybody, and best wishes from APF and personally. Thank you.
Lovely. No, yes, that you're right, Hassan. We are right now on this call have people from 4 different time zones, from Pakistan to the East Coast to the West Coast and everything in between. So thank you all for coming and showing your commitment for this kind of work and this kind of effort. On that note, Dr. Nasser, please take the floor and conclude today's day.
Thank you. Thank you, Hania. I have to say, these were some amazing, insightful, and thought-provoking presentations, and it just shows the quality of our mentors and also our fellows. And it is very, very fulfilling for us at APF to see these presentations and know what we're doing makes a difference, not only in terms of our fellows, but the outcomes that they come out with. And the question that was raised was, and Dr. Upal raised this question, how do we take this to the next level? So to Dr. Sarah's question, actually, we have been in the process of reaching out to all of our past fellows in the last month. And we'll join the current fellows, and hopefully we'll have a community and see where they are and how they can continue their work or the outcomes from their work. What I see from all the 4 fellows here, that in fact the topics are so interrelated. If you all, and we will try to facilitate that. And I'm sure Henry would do that. He's great at it, to make a group where all 4 of you can talk, because the presentations that said Kani and even Umair's, they tie into each other, and that could really produce a great paper, if not for a scientific journal, but even a white paper that I think it'll be great for APF to publish on its website and distribute to our 30,000 readership. And if you guys would do that, that would be wonderful. This is also the first year that we are giving a stipend to all of our fellows. As soon as you give us the written, whatever the requirements are, we'll be distributing those. I also want to give a shout out to all the Leadership Council members who joined in for today's presentation. It is wonderful to see you all, and we'll be reaching out to you, and Henry would be reaching out to you for the next steps. But it's great to see all of you come join in and attend this conference webinar. And again, thank you to everyone at Sehat Kahani and Atlantic Council for making this happen. And of course, the APF team, you've done a wonderful job. And I personally, as the chair, would like to give my sincerest thank you to everyone from APF here. It is our responsibility to take this wonderful work to the next step, make a community of all of our fellows, and see what we can come out in a unified paper from, or separate papers, whatever you all want to do, but put you all together to see what we can come up with, which can become a sort of a white paper for healthcare, and Umair, what he did for Pakistan, which can be circulated here and in Pakistan. And lastly, but not least, Umair, your question about translating the material. In my past life, I'd done that. We actually did translated a large amount of work for breast cancer for the Pakistani American community, where the elders, a lot of them do not speak English, and distributed it here. And it was distributed in Pakistan also. I can pull that out. And I think if take time whenever you are free, let's talk. And we should be able to do that for specific topics. And that's a great idea. So these are the outcomes which come out of these, and they're wonderful. Thank you again, everyone. It was a pleasure to listen to all of you, and thank you again to all the organizers and participants. Have a good rest of your day.
Thank you, and Khuda Hafiz to everyone.